வணக்கம் அண்ட் வெல்கம் பேக் டு யோர்ஸ் ஐடியா குரு. நான் வந்து கன்சர்ன்கிற என்ஜிஓவில் இருக்கேன். இந்த கன்சர்ன் பற்றி நான் முன்னாடியே உங்களுக்கு வந்து வீடியோ போட்டிருப்பேன். இட்ஸ் அன் ஆல்கஹாலிக் டி அடிக்ஷன் சென்டர். அந்த வீடியோக்கு நல்ல வியூஸ் போச்சு அண்ட் நிறைய பேஷண்ட்ஸ் இங்கே வந்தாங்க அப்படின்னு சொன்னாங்க. இன்றைக்கி இங்கே ஒரு இன்ட்ரெஸ்டிங்கான ஒரு பேனல் நடந்தது. இட் இஸ் அபவுட் டிஜிட்டல் வெல்பீங். ஸோ இப்போ நம்ம எல்லாருமே வந்து ஆல்கஹால் அடிக்ஷன் ஒரு வகையான அடிக்ஷன் அப்படின்னா வந்து இப்போ நம்ம வந்து மொபைலுக்கு அடிக்ட் ஆகிட்டு இருக்கோம். மொபைல் ஸ்க்ரீன் டைமிங், அது ஸ்க்ரீன் வந்து டிவியாக இருக்கட்டும் இல்லைனா வந்து மொபைலாக இருக்கட்டும், ஸ்க்ரீன் டைமுக்கு நம்ம ஃபுல்லாக அடிக்ட் ஆகிட்டோம். we are slaves for the screen time அப்படினே சொல்லலாம். ஸோ அதை பற்றி பேசுகிறதுக்கு we have a big panel of guests. ஸோ அதை பற்றி தான் நீங்கள் இந்த வீடியோ பார்ப்பீங்க. அவங்க வந்து they gave their lots of insights. எப்படி வந்து நம்ம தவிர்க்கலாம், what are the ways we can do. ப்ராக்டிக்கலி பண்ண முடியாது, பட் சின்னதாக நம்ம வந்து ட்ரை பண்ணோம் அப்படின்னா we can be digitally well also அப்படின்னு சொல்கிறாங்க. நம்மளுக்கு கொடுத்துருக்கிற டிஜிட்டல் ஆர் இந்த இன்டர்நெட் ஆர் திஸ் க்ரோயிங் டெக்னாலஜி எப்படி ரைட்டாக யூஸ் பண்ணுறது தான் இந்த பேனலோட மெயின் க்ரக்ஸே. ஸோ இந்த வீடியோ ஃபுல்லாக பாருங்கள். ஐம் ஷுவர் இட் will be very useful to you.
Panel discussion is just an initiative of concern. Why? Because we were so many years with addiction, drug addiction treatment and other addictions, and moreover we were treating psychiatric acute care and into training also. But as a new initiative for this year, we would like to include digital addiction. We want to see how it affects the people and how to come out of it, how to moderate. Introduce our panel, Dr. Muhammad Ridal sir. He's a neuro rehabilitation physician, MD, FNR, PGDHM, and he is our medical officer here. He is from the global hospitals. Please come to the dais, sir. Muhammad Ridal. Call upon Dr. Satish Kumar, consultant psychiatrist, MBBS, DPM and DNB. He is our psychiatrist and he came from CMC Vellore here and he is a consultant here. We request Dr. Satish to come upon the dais. Asha Vinay, special educator cum trainer, MPhil in MSW. She deals with children. I call upon Satyashri, educationalist, MSW, PG diploma in development management, and she deals with Karadi Park children education. Now I call upon the captain, Dr. Thiruvikraman, consultant neurophysician, neuropsychiatrist, our doctor. Not least, I am the founder of Concern. Thank you.
Good morning, everyone. I am Mrs. Rajni Sheeja, Indian New Dawn Foundation.
I'm Shirka, the founder managing trust of New Foundation. The main mission is to create the opportunities and transform lives of women in the rural areas.
I'm Ramesh. I am a friend of Concern, a volunteer. Moreover, I am an alcoholic. I was severely affected by alcoholism before 13 years. With Concern for the past 13 years, I am very much into rehabilitation of alcoholics, suffering alcoholics.
Good morning all. I am Merlin, peer educator.
Hi, good morning. I am Sriram. I am a recovering alcoholic. I am running a Sriram Catering Service company. I just want to know about this social media activities. I just came here. Thank you.
Good morning everybody. My name is Meenot Chisumbram. I am a retired Tahsildar. I have rich experience as an alcoholic, rich experience with working with alcoholics and NGOs like Concern. I am associated with Concern from the day of its inception.
I am Jay Armoria. I am working as a psychologist in Mother Care Foundation.
அனைவருக்கும் காலை வணக்கம். நான் வந்து பாண்டிச்சேரியில் இருக்கேன். மதர் கேர் ஃபவுண்டேஷன் அந்த இதில் வந்து நான் செக்ரட்டரி.
Good morning. I am a student what I've finished is 10th grade. That's all I've done. But as a representation of my generation, I would like to know more about this topic.
Hi, I'm Yuvraj. I'm a filmmaker. Come here to listen and implement the strategies or ways to cut down digital in any of my films. That's the idea I have here. Thank you.
I am working as assistant professor in SRM University, Ramapuram, and also I am head of placements and working as an industry institute relationship officer.
Good morning everyone, my name is Hemlata. I'm coming from Salem. We have kept a rehabilitation center in Chennai, and we are doing many social works and helping many alcoholics and drug peoples.
Coming from Chennai, I'm running a old age home.
Very good morning to everybody here, and my name is Satyashri. I work as an educationalist for past 7 years. And thank you so much for the opportunity. Concern being an ethical organization, it's a proud moment for me to be one among the panelists. So one more question, like what do you think we lose when we are digitally immersed? There are many things, but what is the primary thing do you think we lose?
Time.
Time, yes, correct.
Productivity.
Productivity, okay. The most important thing?
Social contact.
Social contact,
Sleep.
Hobbies. Hobbies. Sorry?
Things that actually interest us, hobbies.
Hobbies, correct. So all the answers are correct, but sleep is the primary factor that we are missing. Okay. Mental health disorder that is going to affect us by the year 2030, the study says. Why? Because of digital addiction. There was one boy in Mumbai. This happened 2 years back in Mumbai. So he was locked up in his room. So his parents thought அவன் படிக்கிறதுக்காக மொபைல் உள்ள எடுத்துட்டு போயிருக்கான் அப்படின்னு நினைச்சாங்க. But என்ன ஆயிருக்கு அப்படின்னு பார்த்தா he was continuously using his mobile for 3 purposes. One is for Instagram, and now there is something called Snapchat. நம்ம எல்லாருக்கும் Instagram and WhatsApp தான் தெரியும். This Snapchatல they always I think she knows better, streakலாம் அனுப்புறவா every day you have to send a streak. So Snapchat, gaming, YouTube. He was continuously using that. So food வந்துட்டு ரூமுக்கு கரெக்டாக டெலிவர் ஆயிடும். So what happened is after 2 days he wasn't conscious. So he was taken to the hospital. Medical intervention was given. The sad part is he was not able to recognize his own parents because he was continuously 22 hours. He was doing all this without sleep, without rest, into the gadget, playing Instagram, Snapchat, WhatsApp, YouTube. This was a routine he followed. So then he was diagnosed that he was addicted. So he was not addicted to alcohol or any other drugs, but he was addicted to the mobile.
Very hard, I think. I don't know, just for discussion's sake. It needs very high level of determination. Very easy.
Easier said than done.
Huh?
Easier said than done.
Easier said than done. I think that's very hard. But I think we will not have any choice.
To start with, the topic is finding balance in information age, a step towards digital well-being. So any idea what is digital well-being? Anyone?
Please be interactive. Let's make it interesting.
So means do everything in the digital and also behave yourself. Your self-awareness basically. Do anything in the digital. Lot of awareness.
Proper management of screen time.
Okay.
How digital aspect does not affect my normal life.
Okay. Using digital technology to overcome the digital burden we are facing. So, why we are facing this digital overburden? Why technology has overtaken us? Anyone? Just youth and IT professional. It is increasing throughout the world, also in India, also in Tamil Nadu. Especially post-pandemic, it has increased significantly. This is the key points from this slide. Okay. Technology to overcome the digital burden we are facing. How it's going to help us is, see, ultimately self-control. So even if you take other types of education, other types of addiction, self-control, but that is not the only thing. To get self-control, we would like to intervene both pharmacologically, help the person both pharmacologically and through productivity apps and self-limiting apps. There are a lot of self-limiting apps within the smartphone that is going to help you stop using unwanted apps, as Nalsmith was highlighting, and also promote apps that are going to be productive. We have a lot of apps that are very much productive for you. Exactly, computer vision syndrome, which causes you dry eyes. That is a very common complication. In fact, I recently was diagnosed with dry eye syndrome. I was continuously studying in my laptop for a long time. When I had dry eyes, then I was not able to try. I have to continuously take lubricant eye drops. 2-3 days I was off from laptop and phone. After that only it settled. Obviously, I use it for productively. I was studying, but still I developed a dry eye syndrome. Okay. Then sleep, poor academic achievement, withdrawal symptoms. Withdrawal symptoms, what kind of withdrawal we can expect? Any idea? In alcohol, we have sleep disturbance, tremors, irritability, other symptoms. What are the withdrawal symptoms you can expect in when you are stopping from digital addiction? Sorry, if you are going through digital addiction or stopping from digital technology.
Lack of socialization.
Acute withdrawal symptoms. Anger. Irritability. Very good.
Sleeplessness also.
Sleeplessness, anger, irritability, headache, somatic complaints like headache, symptoms. Have time limit. After some time, you will be aware. Okay, half an hour has gone. Now I have to stop. So that is a major advantage. And you can get a feedback also. Every week you can take back and see what are the apps you have spent more time on.
Team concern, because the moment they told me about the talk break, I was really interested in coming here and sharing few insights, because for the last 5 years I've been working with children with special needs, and I also do training with teachers. So I come across a lot of problems among children. So this is a nice forum for me to share few insights. And Delilu, Trulilu and Solilu. Okay, so Delilu means delusional, Trulilu means the truth, and Solilu is solution. Okay, so we all believe that gadget is like taken away most of our time. So, which is actually not true when you look at the impact that it has created on children. Discover change. So please open right away and check. I am sure at least more than 50% of the audience suffer from excess screen time, including me. I have done this recent discovery thanks to Concern again. Okay, the last 2 weeks my daughter is right here. She knows that how much of reading I did on excess screen time, and I was going around telling my family that it is not just one person who's addicted, it's the whole family. Okay, so it's a disclaimer I'm giving you all of us suffer from excess screen time addiction. It is important for us to become aware. And who's going to come and help us? No government is going to come and help us, because government is invested totally on working on technology. Okay, we are all in a tech-driven society. 16 to 18 hours we sleep. In that, almost the family invests on 7 to 8 hours. When I say family, 4 person in a family, 3 hours each, we are already exceeding the screen time. Yes? And what is the recommended screen time? Any guesses? What's the recommended screen time for us as adults?
1 hour.
Definitely not 0.
1 hour.
1 hour? Are you all sure? Yeah. Just to open WhatsApp and close WhatsApp will take 1 hour and a day.
3 hours. 3 hours.
So no? மத்தவங்களோட updates check பண்றதுக்கோ இல்ல messages பார்க்கிறதுக்கோ 1 hour is easily you can invest 1 hour. Okay, so the recommended screen time is 2.5 hours. Okay, 2.5 hours is the recommended screen time for adults. And how old a child should be for you all to pass on a mobile phone to your child or a smart screen? 4 years? 6 years. I can't. 13. I can't detest what doctor says. Okay, less than 2 years, no screen at all. Absolutely no screen, including TV. 2 to 7 or 8 years, that is the primary age group. It is less than 1 hour. Okay, and this is recommended by Indian Academy of Pediatrics. Creative engagement. They all want to stay at home. They want to be with their smartphones, right? They don't want to communicate. And the first 4 hours in the morning is called the golden hour. So you wake up to phone. You become a bot when you're getting up from your cot, everyone. Like you're behaving like a robo, picking up the phone, going to the restroom, watching videos or scrolling through, doom scrolling Instagram. So that has to be broken. So the 4-hour rule you can follow. Secondly, we need to work on 4 things. One is restricting phone usage, right? Secondly, reducing phone usage or any gadget usage. Thirdly, working on a routine. Okay? Set up a routine for the day, whatever you want to do, your hobbies or your important priorities in the day. Set up a routine. And fourthly, work on a relationship. Okay? You have to work on a relationship with your child or with your spouse or with your family, because once you're off the screen, you don't know what to do. Then you go back and see you've lost your relationship with your parents or children or spouse. So
ரொம்ப பாதிப்புலாம் ஏற்பட்டிருக்கு இல்லையா? வேர்ல்ட் வார், பிளேக், இப்போ லேட்டஸ்டாக கொரோனா வரைக்கும் வந்திருக்கு. அது எல்லாமே கான்கவர் பண்ணிட்டாங்க. பட் இவங்கெல்லாம் பேசுறது பார்த்தா ஐ திங்க் திஸ் இஸ் கோயிங் டு பி மானுமெண்டல் மமோத் அண்ட் ஹிமாலயன் டாஸ்க் நினைக்கிறேன் நெக்ஸ்ட் டிகேட் அண்ட் நெக்ஸ்ட் செஞ்சுரிக்கு. பிகாஸ் பயங்கரமாக இருக்குது காம்பினேஷன். என்ன சொல்கிறாங்க, இட்ஸ் குட் as long as you restrict. It's good as long as you restrict. Na the line eppadi podradhu neenga?
I am basically a neuro intensivist with fellowships in neuro rehabilitation and neuro palliation with special interest in neuro philosophy. Right. The old people, 1800s, 1810 la pirandavanga enna sonanga, the book varumbodhu ஏன் புக்ல படிக்கிற, ஏன் புக்ல எழுதுற, ஸ்லேட்ல எழுது அப்படின்னு சொல்லிட்டு இருந்தாங்க. Because they thought book was a fad and it was not something which is going to be permanent. But cut 100 years, book is commonly used. Right? Now technology or whatever or the apps and all this thing which is coming is going to change in the next 100 years. How many of you agree that in the next 100 years, when our children are in the grandparents' stage or whatever, they will say, don't do that and use the phone? Human to survive, what are the 3 things needed for you? Food. Excellent. Anything else? Sorry, water.
Food, shelter, water. That's what we studied in social science.
Okay. So we got food. Good. It causes a feel of, it causes a feel good sensation, right? In the dopamine is not only useful for that, it's also useful in some other functions like cognition and movement. Cognition, higher thinking, movement. This will help out. On top of that, it is helpful in reinforcement learning and the sense of feeling good.
Like addiction and psychiatric disorders. Main இதுதான் கவர் பண்ண போறேன். So introduction is like understanding the link between technology addiction and various psychiatric disorders is crucial for addressing the mental health effectively. To take care of our mental health, the presentation explores specific disorders. நிறைய இருக்கு, but காமனா நம்ம அண்டர்கோ பண்றது or what I come across in my clinic, I'm just addressing it. The very common one is depression. So impact of screen time on depression, screen time on self-esteem. In depression na you don't come across the typical depression like suicidal ideas, worthlessness, guilt, ipdila irukadhu, but it affects more on their self-esteem, which leads to lack of confidence, inferiority complex in the marilla. So excessive screen time, especially on social media platform, can lead to unhealthy comparisons and feeling of inadequacy, as they have mentioned. Using certain time, it doesn't help them. So they keep increasing the time, by which they become more addicted to technology. Generally, ஒரு குழந்தைக்கு ஒரு 2 தாட் ஓடிட்டு இருக்குது மைண்ட்ல, ஒரு 3 தாட் ஓடிட்டு இருக்குது அப்படின்னா ADHD kids மைண்ட்ல ஒரு 10-20 தாட் ஓடிட்டு இருக்கு. So they won't be able to concentrate what to do. There are 10 things kept. So they have to eat everything. இதுல கொஞ்சம். that's when they keep shifting their attention from one to another. So same thing happens in media. As they said, as you all said, reels are like not more than 5 seconds, 10 seconds, 30 seconds in the money. This is all, or like to put it another way, it's all research based. The gaming companies, Insta, this sleep. If you are getting disturbed sleep, if you are getting up midnight, if you are not sleeping properly, it means you are going to go into some sort of psychological problem. So sleep is very important. So again, once you start using technology, your sleep gets disturbed, and the cycle mara, various psychiatric illnesses, mental health issues crop up. I mean, as we were discussing about sleep, yes, sleep plays a very, very important role. தூக்கமும் தண்ணி குடிக்கிறதும், it is like a medicine for us, for the body as well as the brain. Brain na சொல்லும்போது it is more, I would say, mind. And really appreciate her talk on uninstalling the unused apps, which I have done. Here I'm going to share my personal experience and with my clinical experience. So, நிறைய games I used to play, unwanted games, time pass. எதுக்கு games விளையாடுறோம்? I'm not depressed, at least I'm not depressed. Anxiety, something, some issue, boredom. But again, that takes up a lot of my productive time. How do we differentiate normal from abnormal?
Introspection.
Like normal behavior from abnormal behavior. Normal pattern of tech use, normal pattern of alcohol use from abnormal. Comparison, problematic use.
Comparing with another person. எனக்கு பிரச்சனைன்னு வரும்போது
the moment it interferes with your day-to-day routine, right? Then it's a problem. Routine, daily life. If it is whatever you feel that is interfering with your day-to-day routine, you need intervention. If it is not interfering with your day-to-day routine, you can continue. So that's something we develop on. We know where we are going, out of line or are we in line. So, adukku munadi I'll put another thing. Is multitasking good or bad?
Bad.
Is multitasking a nice talent or not?
Bad.
Good.
Bad.
It is a necessity, I think. It is a necessity.
So, எல்லாரும் சொல்லுங்க, எல்லாரும் சொல்லுங்க.
Good.
Okay.
Depends upon
Bad
situation.
Yes,
Bad.
obviously, it's very bad.
Very bad.
Very bad actually.
Not being focused.
இது வந்து ஆத்துல ஒரு கால் சேத்துல ஒரு கால் கதறோம். Multitasking. Company will need multitasking because they want their work to be done. But for us, individual perspective, multitasking is very bad. Mindfulness is the thing. So how do we do mindfulness? I mean, how do we practice mindfulness? ஏதாச்சும் ஒரு வேலை பண்ணும்போது நம்ம அதை ஃபுல்லாக கான்சென்ட்ரேட் பண்ணி பண்ணணும்னா முடியாது. It's tough. So how do we do it is start from our day-to-day routine. Routine activities என்னென்ன பண்றோம்? பல்லு விளக்குறோம், குளிக்கிறோம், சாப்பிடுறோம். இதெல்லாம் routine. Why do we call it routine? We don't put in effort, think and do. Automatically it happens. So இந்த activitiesல mindfulness-அ கொண்டு வாங்க. Withdrawal psychosis is different. Withdrawal-னா ஒரு பொருளை எடுக்கும்போது when you stop alcohol there is psychotic features like hallucination, delusions எல்லாம் இருக்கு. That is different. So அது வந்து எப்படி நம்ம சாப்பிட்டே இருக்கிறோம், டக்குன்னு சாப்பாடு நிறுத்தினா என்ன ஆகும்? Excessive hunger. That is withdrawal. That settles over a period of 1 week or 10 days. But if it continues, the psychotic behavior continues beyond 10 days, 2 weeks, then it becomes induced psychosis.
I started using headphones to listen to songs and all. What happened after I removed the headphones also, I could hear the voices. So I stopped using headphones.
It is not only for headphones, anything it can happen. So your brain is tuned to that.
So I stopped using headphones because I was hallucinating.
To conclude, we want to know the basic outcomes for this panel discussion. So what is the outcome of this panel discussion?
Depending on all the inputs, so we should form a guideline protocol, where to draw a line, where to call this or எதுக்கு அப்புறம் அது அடிக்ஷன், எதுக்கு முன்னாடி அது நார்மல் அப்படின்னு நம்ம ஐடென்டிஃபை பண்ணுறது, and a major awareness is that இதெல்லாம் பேசுகிறோம் பட் இந்த அளவுக்கு இது ஒரு பெரிய பேண்டமிக்காக மாற போகிறதுங்கிறது இட் இஸ் குவைட் அவேர்னஸ்.
Okay, the awareness that it's going to turn into a pandemic soon. Okay, doctor, thank you.
அழகாக ஆரம்பிச்சிங்க நீங்கள் பேசுகிறதுக்கு. நீங்கள் நல்லா அழகாக பேசுனீங்க, ரொம்ப இன்சைட்ஃபுல்லாக நிறைய பேசுனீங்க. ஆஷா அக்கா உங்களோட எக்ஸ்பீரியன்ஸ் தெரியுது, நிறைய கன்சர்ன் தெரியுது உங்ககிட்ட, நிறைய யங்ஸ்டர்ஸ் கிட்ட. அப்புறம் இவரும் நிறைய ப்ரெசன்டேஷன்ஸ் நல்லா பண்ணார். அப்புறம் சார் வந்து ரொம்ப கூலாக அப்படி ஹேண்டில் பண்ணுறாரு. ரொம்ப நல்லா இருந்துச்சு உங்களோட ப்ரெசென்ட் பண்ண விதம். பட் இதில் எனக்கு ரொம்ப பிடிச்சது வந்து முகமதோட ப்ரெசன்டேஷன். ஏன்னா முகமதோட கான்ஃபிடென்ஸ் இருக்குல்ல, ஐ திங்க் ஹீ கேன் ஈவன் வித் போரிங் டாபிக் ஹீ கேன் ப்ரெசென்ட் இட் வெரி வெல். I thank you all of you and see you soon again.
Thank you.